Hello and welcome to this special broadcast. I'm Priyadarshini Medhi, and today we are going to discuss on various urological problems basically during the summer season. Well, urological diseases or conditions include urinary tract infections, kidney stones, bladder control problems and post-rate problems among others. So, to discuss on all these, I have with me today in the studio Dr. Arup Kumar Nath, urological laser surgeon. So, Dr. Nath, welcome to Northeast Live. Thank you so much for joining us this afternoon. So, Doctor, first of all, tell us that when we say the term urology or the urological system, what does it actually mean?
Actually, the urological system is called the urogenital system. So, there are two parts, the urological system and the genital system.
Right.
And the urological system, there are organs which actually handles or forms urine, and the genital part is the external genitalia and some accessory sexual organs in males. Like for the urological organs, like the kidneys, which forms the urine, and the ureters, the small tube which carries the urine from the kidney to the urinary bladder, and the bladder is the reservoir,
right,
where the urine is deposited till the person feels the urge to urine, when there is approximately accumulation of 250 to 300 ml of urine.
Right.
Then the urine is carried through the urethra, which carries the urine from the urinary bladder to outside, and then the prostate gland and the external genitalia, that is the penis in male and the testis. So, these are the organs which actually falls in the urogenital system.
Right.
So, the diseases involving all those organs is in the territory of the urologist.
Right. So, Dr. Nath, also tell us, what are the dimensions or diseases, that are treated under the branch urology?
So, if we see the diseases involving the kidneys, can be urinary infection, then the kidney stones, and some congenital condition which are there from birth, like pelviureteric junction obstruction, then horseshoe kidneys, when both the lower pole of the kidneys are attached together, and there are some cancers also, kidney cancers and all. Then diseases of the urinary bladder, like tumors, again some stone may be formed in the urinary bladder. At the same time, diseases of the prostate gland. In the young male, we find a common disease called prostatitis. Then in the elderly male, there are two common diseases of the prostate gland. One is prostate hyperplasia, that is the enlargement of the prostate gland leading to the urinary problems, like difficult to control urine, then going to pass urine again and again, then applying force to pass urine, waking up at night again and again, then the prostate cancer. So, these are diseases of the prostate gland. At the same time, there are some diseases of the urethra also. So, can be urethral infection, then stricture, where there is narrowing of the urethra. This is the small pipe which carries urine from the urinary bladder to exterior. So, there may be some narrowing called stricture. And at the same time, there are lots of diseases involving the penis in males, like phimosis, when the skin covering the tip of the penis gets very adherent and small. So, at the same time, there may be phimosis, paraphimosis, then the cancers of penis. There are lots of conditions of the testis also. There may be hydrocele, there may be torsion of the testis, when the testis get rotated, and it may lead to complete damage of the testis if we do not treat it promptly. At the same time, there are again infection and cancers of the testis also. Along with there are failures of the kidney, which needs the kidney transplantation as the permanent procedure. Temporarily, there may be dialysis, but permanent treatment for kidney failure is kidney transplantation. That also falls in the territory of urologist. At the same time, female urinary problem, like again dysuria, pain while passing urine, and going to pass urine again and again, and there are some other conditions like inability to control urine while coughing or sneezing. So this is called stress urinary incontinence.
So those are the symptoms.
Yes, those are the condition again, that is female urinary problem.
Right.
That also comes in the urological domain actually.
Dr. Nath, see, kidney stones are very common nowadays,
Yes,
isn't
yes.
it? So, what are the causes of kidney stones? I'm sure our viewers would like to know about this.
So, kidney stone is a very common disease, and if we see, there are 15% incidence of kidney stone and among the general population,
Right.
and it is increasing with each passing day.
Yeah, it's
And
increasing tremendously. nowadays.
tremendously.
Yeah.
If we see after the industrial revolution, the chances of occurrence and detection of kidney stone is increasing, and that is mainly because of the changed lifestyle and dietary habit of the population in the entire world. So, if we can say that. That kidney stone, you cannot say it is a single cause. It is called multifactorial causation of disease, and
So, there are various causes.
Various causes, but the main mechanism which leads to kidney stone formation is the dehydration. That is decrease in or deficiency of water in the body, dehydration.
Right.
So there are lots of conditions which leads to dehydration. That may be like people of the desert area, or maybe in the hilly states or countries where it is difficult to find water, and at the same time there are people which works in very hot environment, and there are other conditions like some familial condition by birth, like renal tubular acidosis, medullary sponge kidneys. These are the conditions where there are increased chances of stone formation. There are some other conditions when there is block of urine flow from the kidney, like pelvic junction obstruction, horseshoe kidneys. This also leads to stone formation. And among that, again, diet plays a very strong role in stone formation. And after diet, there are some other diseases like diabetes or parathyroid tumor, or some diseases which involves the alimentary tract, that is the gut, the intestines. In these conditions also there are chances of stone formation. But if we see, it is mainly dietary and environmental causes which leads to stone formation, and that is the main reason why the chances of stone formation is increasing gradually. And in Northeast also, we can say that in some like the other part of countries, if we see, like in Gujarat, Rajasthan,
Right.
These are, you can say, a stone belt. In Northeast also, some part of Assam, like because we move around a lot,
Right.
so from our impression, it is the Dima Hasao, then Karbi Anglong, then Barak Valley, and some part of Mangal Doi are stone belt in Assam. And from the other states, if we see that Meghalaya and Manipur, lots of people develop
They're
kidney
suffering
stones.
from all
kidney-
right. So
kidney stones.
it basically depends on the lifestyle and the
And
food
the diet.
habits.
Yes, food habit.
That is very important. All right, viewers. So on that note, now it's time for a very short break. And as I've already mentioned today, I have with me Dr. Arup Kumar Nath. So we will discuss more about the symptoms of kidney stones. Right now, it's time for a very short break. So stay with us. Welcome back to this special broadcast as we are discussing about various urological problems. And before the break, as I've already mentioned that now we'll be discussing about the symptoms of kidney stone. So doctor, what are the various symptoms, when one person is suffering from kidney stone?
Nowadays, most of the patients referred to us, to the urologists, are asymptomatic stones, because nowadays people are little health conscious. It is a very good sign that people are now doing regular health checkup, and for other reasons, when ultrasonography was done, and some stones are there in the kidney, small stones. So most of the people having kidney stone are asymptomatic, because they are very small stones referred to us. But the symptoms, if you can say, it is the pain. The renal colic is the symptoms, and a patient, it is a very severe pain felt in the renal area, that is in the back, just below the ribs towards the vertebra, that is called the renal angle. So the pain starts there. It's a very severe pain, and when a patient comes with renal colic to the emergency department, even after seeing some patient, people can understand that this may be a patient of kidney stone, because he will toss around in the emergency bed to get some relief, and it is a spasmodic kind of pain. The pain comes, and after some time the pain goes. So and at that time a patient will be totally pain free, but after some time again recurs. So this is the renal colic, and along with that the patient may have vomiting, or more commonly nausea. Vomiting sensation will be there when the kidney is blocked. Vomiting sensation will be there, and when the stone comes down through the ureter towards the urinary bladder, patient may have may develop symptoms of like urgency to go to pass urine again and again. There may be hematuria, blood may come in urine, and when the stone causes infection in the body, the patient may come with fever.
So what are the how are kidney stones diagnosed with?
So when a patient comes to emergency department like this, so the investigation of choice is a CT scan, plain CT scan. The detection rate is nearly 100%. And otherwise, ultrasonography, X-ray, KUB are the investigations with which we get some idea, and to confirm we do a CT scan. And we can even assess the function of the kidney sometimes, because a long-standing kidney stone even may damage the kidney. So in that case, if we do a CT urogram, we come to know about the function of the kidney before taking out the stone or offering conservative treatment. Sometimes we may need to know the function of the kidney, and CT scan helps. Sometimes we may need to do a isotope scan also, renal scan, and if CT scan shows that kidney is non-functioning, so at that time we may need to do a renal scan also, along with serum creatinine, urine routine examination, blood examination. These are the routine examination we do for kidney stones.
So doctor, what are the treatment protocols for a kidney stone? Like, is it always that the person, if he's suffering from kidney stone, he has to undergo an operation?
So this is a very good question, and at the same time we need to discuss, because lots of patients come to us with apprehension that we went to some doctors for other region, and ultrasonography showing small stones, 4, 5, 3 millimeter stone on both the kidneys, or sometimes in one kidney without any symptoms. So these are the patients who actually do not need surgical intervention.
All right.
We need to offer them stone dissolving therapy, and sometimes if the patient develops stone pain, for that we offer analgesic on SOS basis, when there is pain only, not regularly, and at the same time we advise them to follow a strict dietary regime, because it is the diet which helps in kidney stone formation. At the same time, it helps in increasing the size, because the treatment depends on the size. If the stone size is less than 7 mm, unless there are some other indication, stone less than 7 millimeter, we can dissolve with medicine, but the medicine should be taken for long period, and the patient needs to be followed up like on 3 and 6 months basis by ultrasonography, and if the stone dissolves, we ask them to continue with the dietary regime after it is dissolved. If it is not dissolving, we continue the dissolving therapy, at the same time the dietary advice, and we follow up the stone at 3 and 6 and 12 months interval with ultrasonography and all. And if the size increases and the patient develops symptoms, in that case we need to remove the stone by
so the treatment will basically depend on the size of the stone,
and on the size and the symptoms.
All right. So Dr. Nath, could you please let us know about the preventive measures and the diet regimen for kidney stone patients?
So the recurrence rate of kidney stone is very high. So it is up to 50%. So it is very painful for us to inform the patient that if you are coming to surgical treatment to us, even after removal of the stone, you have a chance of nearly 50%. That is one among two patients will develop kidney stone again if they do not take care of their diet, if they do not increase their fluid intake. At the same time, they need to do from time to time some evaluation, like investigation at 3 to 6 months interval with ultrasonography and all. So first, to prevent kidney stone recurrence is the diet. So we offer each and every patient coming to us, not only the kidney stones, other people also who visit our clinic, we offer them with a dietary restriction chart. Earlier we used to provide them with a leaflet. Nowadays we are providing them with videos, which is there in our YouTube channel, Dr. Arup Kumar Nath. People can see it. And at the same time, the diets are like we ask them to take less of non-vegetarian food and the food which contains lots of oxalates and uric acid, and we ask them to avoid excessive salt, excessive sugar, and cold drinks and all, and non-vegetarian food definitely needs to decrease. And at the same time, if the patient is diabetic, the sugar needs to be controlled. And at the same time, we ask them to take more of diet which are rich in citric acid, rich in vitamin B6, and rich in water content.
So homemade food is more preferable during kidney stone.
Definitely, and foods like water, coconut water, and banana, then pineapple, watermelon. These are the foods which actually contains maximum water.
Okay.
So and citric acid. People can take orange, lemon. So these are the things. Citric acid helps in dissolving the stone. At the same time, potassium, vitamin B6. These also helps in decreasing the stone size. So these are the foods to be taken more, and the other which we have just mentioned, the other foods people need to decrease.
So when we talk about urogenital cancers or urological cancers.
Yes. So the urological cancers, it starts from kidney cancer, then the urinary bladder cancer, prostate cancer, at the same time the cancer of the penis and the testis. So among them, most common cancer in the urogenital system is the cancer of the prostate. And if you see, it is nearly the #1 cancer detected in males worldwide. Though in our developing countries it is not that much, but gradually it is catching up with the developed countries also. So prostate cancer is a cancer of elderly male. It is detected mostly in males of more than 60 years of age, and after that comes the kidney cancer, and kidney cancer is also a common cancer, and it is again increasing in incidence, and after that it is the bladder cancer. So kidney cancer and bladder cancers are mostly related to tobacco intake. Okay. So we are getting more and more bladder cancer patients coming to us, and it is very actually disheartening to see that very young people also coming with kidney and bladder cancer, which actually a cancer of elderly male. But nowadays we are getting like bladder cancer, we have treated, the youngest was 24 years male. And even for kidney cancer also, one guy, I have done laparoscopic removal of the kidney with the cancer. The age was nearly 26. So it is very painful actually, and apprehensive also that such young people are developing kidney and bladder cancer, and it is increasing in our northeastern region.
So we would like to know the about the availability of the advanced treatment facilities for kidney stones or kidney cancer. So in our state, are there advanced treatment facilities available in the entire Assam?
For kidney stone, if you ask me, for kidney stone, we are at par with any best center in the country or the world, because we are doing now laser treatment, which even we can do as daycare treatment.
Right.
So for smaller stones, we do not even admit the patient. They come in the morning and then they can walk back to their place in the evening after the procedure. So daycare laser treatment we are offering to the patient. So for kidney stones and for bigger stones, we do pinhole technique that is called PCNL. That is also very commonly done at our place nowadays, and we are at par with any best center in the country or world. For urological cancers, yes, for renal cancer, for bladder cancer, for prostate cancer, all the treatments are available, and even we are offering laparoscopic treatment for all those advanced cancer. But definitely for robotic surgery, we are still lagging behind, and for some of the diseases like prostate cancer, yes, lasers, robots definitely have some advantages, but at the same time it can be even done laparoscopically, and we have done plenty of prostate cancer patient laparoscopically, and we are regularly operating kidney cancers laparoscopically. When the kidney cancer is detected at a very small size, like less than 4 centimeter, we can even laparoscopically remove the cancer and save the kidney. That is called laparoscopic partial nephrectomy. That is a very technically demanding and skillful surgery that also we are regularly offering to our patient. That can be done by robot also. So a robotic facility till now we do not have for urological cancers at our place, but laparoscopically the same treatment we are offering laparoscopically.
All right. So what is the estimated cost of a kidney transplant, or we talk about the laser treatment as you are mentioning?
For laser treatment of kidney stones, it is a little costly because the gadgets, the lasers, it is very costly, and the machines also like flexible ureteroscopy and lots of disposable things also required for removal of kidney stone with laser. It is very patient friendly because there are no cut, no stitch, and at the same time it is painless, and the hospital admission is very less. So if we finally see the cost of open surgery or conventional surgery and advanced laser surgery, it remains nearly the same, because in laser treatment the patient needs only 1 day or maximum 2 days in the hospital, and it takes very less time to come back to their work. So work loss is very, very less. So you need not have to stay longer in a bigger place like the metro cities for laser treatment. So finally, if we see, it becomes even economic. The laser treatment becomes economic for kidney stones than the conventional treatment. At the same time, the laser treatment for like bladder cancer, we are among the pioneer in the country to offer laser treatment like thulium fiber laser en bloc enucleation of bladder cancer at our place, and that is also we are doing mostly as a daycare technique. So that also decreases the cost, and as myself and my 4 co-urologists, we are working as a team, and we also visit to all those interior places and the other northeastern states. So once we operate the patient, our co-urologist or myself will be available in different parts of state or the northeastern states. So it will be easier for the patient. So that way also the cost come down, because they need not have to come back to our place for the checkup and all. So they can do their checkup at their own place. And at the same time, for urological cancers, the laparoscopic treatment is a little costly, and it actually depends whether it is for the kidney cancer, it is for the bladder cancer, for the prostate cancer. Because like prostate cancer and urinary bladder cancer, laparoscopic removal is a very big surgery. It takes nearly 7 to 8 hours in the operation theater. You need 2-3 urologists and general surgeons also along with. So it is a team approach, and time spent in the operation theater also adds to the cost. But it is a very very encouraging, and for the people of Assam, that it is included in Ayushman Bharat scheme for the kidney and urological cancers. So nowadays we are planning to offer in our upcoming kidney hospital.
So thank you so much, Dr. Arup Kumar Nath, for joining us this afternoon. So viewers, I'm sure this show will be very, very beneficial for all our viewers. So on that note, that's a wrap. Keep watching Northeast Live. Thanks for watching.